These days, I'm feeling thirsty all the time. I'm eating a lot, and in spite of that, I'm losing weight. I need to get up so many times at night to pee. My wound healing is delayed. I'm getting blurry vision from time to time. I am feeling dryness and itching on my skin. I'm getting sick frequently. I'm feeling tired most of the time. I have numbness and tingling sensation in my hands and in my feet. What is wrong with me? What's going on? Am I having prediabetes? Have I become diabetic? Assalamu alaikum. I'm Dr. Mariam Ateek, and today we are going to answer to all these questions that the people come up with when they have started suffering from diabetes. Diabetes, we know, is a multi-system disorder in which there is increased blood glucose in the body. This blood glucose is taken up by the cells for energy, and to take it up, it requires insulin, which is a hormone secreted by the pancreas. So in case of diabetes, either the pancreas does not secrete this insulin at all. This happens in type 1 diabetes, which usually occurs in children. There is a genetic abnormality, the genes are faulty, so there is an autoimmune reaction, and our own immunity cells, they kill these islet cells of the pancreas that secrete insulin. So there is total lack of it. And the only way the child can survive is to take insulin injections throughout life. Then there is the other scenario in which the insulin is there, but the quantity is less than what is needed by the body, or there is insulin resistance. This happens usually with people who are older, and this is called type 2 diabetes mellitus. It is also called maturity onset diabetes or the lifestyle diabetes. So, who is prone to it? Who can get this? For this, we need to know the risk factors. Everyone is not going to get it, but there are too many people in the world, around 422 billion, which are already suffering from the disease. So you do not want to be one of them. Take care. Who is at risk? Remember the 5 F's: fat, 40, female, fertile, with the familial tendency, in which brother, sister, mother, siblings, aunts, uncles, they are suffering from it. It runs it from family to family, and you are also more prone to it. Then those who are overweight, who smoke, who are into alcoholism, who have a sedentary lifestyle. They do not have enough physical activity in their life. They are all prone to it. Then pregnancy is a condition in which even healthy females, due to body overload, can get into high blood glucose levels, into prediabetes, which are usually reversed within 6 weeks of giving birth, but sometimes if they have the background, then they can go into frank diabetes, or later on in life they have the tendency to develop diabetes. Then PCOS, the polycystic ovarian syndrome, is another female condition in which the body gets resistance to these insulin, and the people tend to get high blood glucose levels. Then unhealthy eating is one of the major factors that leads to this disease. That is why it is called the lifestyle disease, in which your eating habits are not right. So what can you do about it? First of all, if you are having these symptoms, go and consult the doctor. They will give you blood tests, the fasting blood glucose levels, the random blood glucose levels, and the glycosylated hemoglobin levels, which will determine which category you are falling into. Either you are totally normal, or you are pre-diabetic. That means you will later on develop diabetes if you do not take care, or you are already into frank diabetic condition. And then you will be advised your medicines as per your need, and the doses will have to be adjusted. You have to take all these very regularly. Next comes your part, where you have to make lifestyle changes. What would that be? First of all, have a routine lifestyle. Wake up at the regular timings, sleep at regular timings, exercise at regular timings, and eat at regular timings, and even eat somewhat the same quantities of food, so that the body does not go into a chaos trying to understand what is happening every now and then. Then you have to reduce weight. You have to increase physical activity, at least 30 to 40 minutes, 5 days a week minimum. You can do anything you want. You can walk, you can jog, you can run, you can do yoga, you can do workouts, anything you want. You can dance, you can do cycling, but you have to be physically active. Then you have to sleep well. Adequate sleep is required because our bodies have internal clocks. Different hormones are secreted according to these clocks. If you are not sleeping, then the body will not know how to behave at what time. So sleep properly. The 6 to 8 hours for adults, and children will need more sleep. They will need 10 hours, and the even younger ones will need around 12 hours. This we have already discussed before in the other videos. Then you have to ease stress. These days, no doubt, the lives are very stressful, and everyone has got goals to meet, and we always feel that there is less time and more goals to meet. So you have to try to balance them out so that there is less stress. Then forego with the dirty habits of smoking, and if you are into alcohol, quit smoking altogether. Those who take alcohol, they should reduce the quantity. If you do all these things, you can try to control your life and reverse this pre-diabetic condition. And if you are into frank diabetes, that can also be controlled at a good level. Then eating healthy, because that is one of the major factors of diabetes. This is what we need to take care of. Make rules that you will eat whole grains instead of the other ones. Now, what are whole grains? Whole grains would be like brown rice, whole flour, whole wheat, and whole oats, whole rye, quinoa. These are the ones. And what you have to leave? You have to leave the white rice, the white flour, and the white starches. Do not eat those. Do not eat the sweetened cereals. Go for the whole ones. Then increase more and more green leafy vegetables. Go away with the starchy vegetables like too many sweet potatoes, too many potatoes. Do not take them. Take the green leafy vegetables. They are much better. Then go away with the red meats like mutton and beef. Instead, take the lean meats, the fish, poultry, turkey, tofu. Then in the dairy products, go away with the full fat milk and yogurt and butter. Instead, take the skim milk and yogurt without the cream. So if you do all these lifestyle changes, these diet changes, you can control your health. So please take care, recognize your symptoms, consult the doctor at the right time, and make your lifestyle changes and stay away from this deadly disease, which in due course of times affects the entire body from head to toe. Take care. Allah Hafiz.